Welcome. Thanks for checking out this quick presentation on ADME. Now let's touch on an important component of toxicology, pharmacokinetics and pharmacodynamics. Pharmacokinetics describes the movement of drug in the body, including its absorption, distribution, metabolism, and excretion, or ADME. Pharmacodynamics describes the relationship between drug concentration and its effects on the body. The dose-response relationship. The relationship between the amount or dose of the toxicant administered and the resulting biological response. This is fundamental to understanding toxicity of a substance. This is impacted by several factors: route of exposure, the duration of exposure, the susceptibility of the individual, as well as other factors including genetic variations, age, and underlying health conditions. All of these impact how the dose is going to affect a person. Some types of dose response. We have linear. The response increase is linear as the dose increases. An example of this is alcohol. The effects of alcohol on the body, impairment of motor skills and cognitive functions, increase linearity with the amount of alcohol consumed. Then we have nonlinear. The response increases disproportionately to the dose. We have threshold effects, where a minimum dose is required to produce a response. An example of this is vitamin C. A minimum dose of vitamin C prevents scurry, but beyond this threshold, no beneficial effects are observed. We have saturation effect. A maximum dose response is reached, even with increasing doses. An example is insulin. Once an insulin receptors are all occupied, increasing the dose of insulin does not further decrease blood glucose levels. Then we have the U-shaped response. It shows an initial increase with an increasing dose followed by a decrease in it higher. An example of this is hormesis with radiation. Lower doses of radiation may stimulate cellular repair mechanisms, but higher doses can be harmful and decrease cellular function. So there's a certain point the dose starts to have a negative effect. Now let's dig into ADME. Starting with A, absorption, distribution, D, M, metabolism, and E, elimination. ADME refers to the process that the drug undergoes within the body after administration. These processes determine the amount and duration of drug exposure to the body, as well as its effectiveness or toxicity. Absorption. This is the process by which the substance enters the body and reaches the systemic circulation system. Typically occurs at the site of an administration, either oral, intravenous, or dermal. This is how the drug enters the body. Some factors affecting absorption: the physicochemical properties of the substance, specifically molecular size, lipophilicity, ionization state, or formulation; the route of administration, either oral, intravenous, intramuscular, inhalation, or dermal; and the presence of other substances, including food, other drugs, or alcohol, as well as physiological factors, including pH, blood flow, surface area, gastrointestinal motility, and skin integrity. All of these impact the way a drug is absorbed in the body. Distribution. The process by which a drug or chemical compound is transported throughout the body by the circulatory system. After absorption, the compound enters the bloodstream and is carried to various organs and tissues. Some factors affecting distribution include blood flow. The rate depends on blood flow highly, and highly perfused organs such as the liver, brain, and kidneys receive more blood flow than less perfused tissues like fat. Solubility. Solubility of a compound affects the ability to cross cell membranes and enter tissues. Lipid-soluble compounds can easily cross cell membranes, whereas water-soluble compounds require specific transportation mechanisms. Molecular weight. The size and shape of the compound affects its ability to enter tissues. Small, lower molecular weight compounds distribute more rapidly. And protein binding. Many drugs and chemicals bind to plasma proteins. Highly protein-bound drugs have smaller distribution volumes compared to and remain in the bloodstream longer than low protein bound drugs. Metabolism refers to the process by which the body breaks down drugs or other foreign substances into smaller molecules that can be excreted from the body. Phase 1 and Phase 2. Phase 1 metabolism. They involve enzymes that oxidize, reduce, or hydrolyze the drug molecule. The resulting metabolite may be more or less pharmacologically active than the parent drug. It is mainly carried out by the cytochrome P450 enzyme, or CYPs, in the liver. Phase 2 metabolism involves conjugation of the metabolite with a polar molecule such as glucuronic acid or sulfate. Makes it more water-soluble and easily excreted by the kidneys. Carried out by enzymes in the liver and other tissues. Factors affecting metabolism. Several factors can affect the rate and extent, including genetic variations in drug metabolizing enzymes, age, gender, disease states, and interactions with other drugs. Some drugs may also induce or inhibit the activity of drug metabolizing enzymes. And excretion. The process by which a drug or its metabolites are eliminated from the body. This is often through feces, urine, sweat, or breath. Some of the mechanisms involve the transfer of drug from the bloodstream to the excretory organs. The primary organs of excretion are the kidneys, liver, and intestines. The liver plays a crucial role in excretion by metabolizing drugs into more water-soluble forms. The kidneys filter these drugs from the bloodstream and eliminate them in urine. And the intestines eliminate drugs via bile into the feces. If you enjoyed that, check out this presentation.